During the pre-1980, it is believed that HIV originated in Kinshasa, in the Democratic Republic of Congo, when the virus crossed species from chimpanzees to humans. The available data prior to 1970 suggested that the HIV pandemic started in the mid to late 1970s, and by 1980, the virus have already spread to North and South America, Europe, Africa, and Australia, with estimated 100,000 to 300,000 people possibly infected individuals. During 1982, there were a group of cases among gay men in Southern California that the cause of the immune deficiency was sexual, and the syndrome was formally called gay-related immune deficiency, but later on in September, they used the term AIDS, acquired immune deficiency syndrome, for the first time. The HIV/AIDS pandemic has devastated lots of individuals, families, and communities. It has left millions of children orphaned. It also left disrupted villages and community life, and also increasingly contributes to the erosion of civil order and economic growth. Risk assessment specifically on sexually transmitted diseases and blood-borne diseases is even more critical in the HIV/AIDS pandemic. Here are some of the things to consider in risk assessment for HIV/AIDS pandemic. Sexual and drug substance usage risks must be determined during a health routine history every now and then, as there are new patients and it must be updated regularly. This risk assessment helps to identify people are risk, support recommendation for HIV and other STDs, and other diseases that causes light to infectious diseases. This assessment can also help the people infected on how they could cope up and access treatment, and also learn how to avoid transmitting the disease to another person. Millions of people in African countries died from HIV/AIDS related complications between 1995 and 2005. The poorer countries that faces high burden of HIV/AIDS still sees the disease as a death sentence. Compared with the other regions of the world, the sub-Saharan Africa has the highest infection level since it has low access to health care, and least economic stability. Africa is the continent that has the most population of PLHIV, or people living with HIV. It was hard for the African people to avoid transmission of the virus because of the reasons stated why they have the highest population of PLHIV. According to the World Health Organization, WHO, there are estimated 34.3 million people infected with this virus at the end of year 1999, and an estimated of 15,000 people that are infected with the virus each day. Parallels can be seen in some developed countries during the pandemic. Just like in the United States, the marginalized sector of the country are overrepresented, and are increasingly at risk to the virus. In 1998, the 45% of the reported cases of AIDS was among the African Americans and 20% are Hispanics. The HIV/AIDS pandemic has taken a lot from the various parts of the world. The infection in some areas has spread rapidly to the general population. The spread also remained on the higher risk population, which are the sex workers and their costumers, men who have sex with men, and people who are injection drug users, IDU. This virus is the fourth leading cause of death worldwide. According to 1999 estimates, 18.8 million adults and children have died because of HIV/AIDS ever since it begun. At the start of the 21st century, about 24.5 million adults and children are infected in the sub-Saharan Africa. In the year 2010, the child mortality projected to increase to 150 per 1,000 population in Botswana, 120 per 1,000 in Kenya, 230 per 1,000 in Malawi, and 200 per 1,000 in Zambia. On the other hand, India, where 3.7 million are living with HIV/AIDS at the end of 1999, has the highest number of PLHIV in Asia. However, given that the country has a large number of population, the overall HIV prevalence rate is at 0.70% and is still low. The world response to HIV/AIDS was focused on prevention through behavior change and vaccine. However, the knowledge of transmission is not enough to stop the pandemic. In the mid-2000s, the response accelerated to universal access to healthcare and treatment that became the major priority for PLHIV. The infection of HIV/AIDS went from being a death sentence to a semi-treatable chronic disease since life-saving drugs were developed in the 1990s and is continuously being improved. In the year 2017, approximately 50% of the HIV are receiving antiretroviral treatment, ART. Since the introduction of the triple drug treatment, people no longer died of HIV/AIDS as they started taking the treatment. Several years ago, there was a debate regarding if donor funds would be better spent on HIV prevention or treatment. Arguments were made that the use of STD control, condoms, voluntary counseling, testing, and safe blood supply was more cost-effective than taking a treatment once you become a HIV. Recently, there have been calls to intensify and improve more the efforts with UNAIDS fast-track strategy that aims to end the pandemic in the year 2030, which is 10 years from now. The major approach the people should take right now is to do prevention. Because in this kind of pandemic, prevention is better than cure, is more effective in all aspects rather than being a HIV and take treatments. Usage of different contraceptives are more cost efficient and is safe as you take precautions rather than taking a treatment. There should be more access to universal healthcare and public health approach to cater the needs of the people who are experiencing the symptoms of HIV/AIDS or people who just want to be more cautious in their health.